This time of year, we use the phrase new year, new you so often, right? We talk about our bodies, our eating habits, hair, you name it. But what about the thing that research shows people notice first? If you want that perfect smile and a healthy one, we have our Dr. Dom Lombardi back with us on this midday. Thanks so much for being here.
Appreciate it, Jen.
Appreciate you being here. Obviously, we talked earlier about how important it is to have a good, healthy mouth. You do everything from A to Z. You're in Sharpsville. Tell us a little bit about some of the routine things that you do and then the more advanced things that you do.
So obviously you come in, you get your cleaning, get your exam. That's what you have to get to know where you are. And then, you know, if we find something, obviously all dentists do fillings, crowns, stuff like that. But say you need a root canal, we do the majority of those in-house. Say you need an extraction, we do the majority of those in-house.
That's nice.
So yeah, it's nice. And people sometimes, a lot of times we can do it that day.
Well, it's nice that you have that full holistic expansion of services, because oftentimes in the past you'd have to be sort of outsourced elsewhere.
Right. And I take pride in my clinical results. You know, if I don't think I can get you the best result you can possibly have, then yeah, we're going to talk to a specialist and we're going to get you where you need to be. But majority of the time, I feel like we can do what you need done.
Yeah, and speaking of, we're going to take a look at some of those things. This is one of the examples, right?
Yeah. This is a
and you
great,
smile because you remember the client.
Great guy. Yeah, he's in his 40s. You know, with his old teeth, he actually looked a lot older. And I was talking to him as I showed him this picture, and he was like, "I can't believe that that's what my teeth actually look like."
Yeah.
You know.
Yeah.
And he thanks me almost every time I see him, so I'm lucky enough to see
What
him.
kind of work is that?
Those are crowns.
Those are crowns.
You know, you can see in there, you know, the untrained eye doesn't really know what it's looking at, but there's a bad crown he has there on the one front tooth, and then there's some decay and just some misshapen and discolored teeth.
So he had some issues and some pain with it, I'd imagine, as well.
Right. We were getting to we actually had to do a root canal on one of those teeth.
Right.
To get it done. And everybody hears root canal, they think taboo. It's really not bad.
It's really not that bad. I've had one, a couple. All right, let's see the next one. I want to get to the other two pictures. This one, this is incredible.
We're in a tough spot here because this is how she came in, and obviously it's tough to. She had something break that she had in there before, and she came in like that, and we were able that day, thankfully.
Wow.
I had the time to get her in a temporary, and then into that permanent, beautiful restoration. It doesn't come out, that's cemented in, and we're proud of that one.
Looks great. All right, the next one is, wow, that's a big, huge
that's a big deal.
Transformation.
Yeah, that's a big deal. We added a lot of chewing potential, a lot of bite as far as getting the back teeth to contact.
Sure.
And then obviously we made her look beautiful. She was in her, I think, her 70s, and you know, when she came in, she looked 85. When she left, she looked 65.
It's just to be able to walk out too and be able to chew properly. Let's talk a little bit about the credit that you offer very quickly, because it seems not affordable, but it can be.
It is, and we in general keep our prices beyond competitive. I want to make it feasible for people, as inexpensive as possible, but it is an investment, even at that. So we have a company we work with who can get you 0% financing for up to a couple years, and I feel that most people are able to make that work.
Especially for long term. Let's bring up your information quickly so people can call. You're in Sharpsville.
There we are.
Give your gal a call there.
Yeah, so we're right there next to the Sharpsville Plaza. Hey, after you come see me, we have a lot of great places to go eat in Sharpsville. Lots of good restaurants. Di Lorenzo's right there, great bakery, and you know.
And they're not even paying you to say that.
That's right. I eat there too. My mom works with me too, so we always end up going to lunch somewhere. So it's great mom and son bonding time. So
well, Dr. Lombardi, thanks for being with us today. Great job. We appreciate it. Here's a look at your winning lottery numbers. We'll be right back.